Actually, good afternoon, technically. How's everybody doing? Welcome to another week. Uh, September 21, a few of us, Dan and Ann and I, were talking about how cold it is, and that's for sure, even though it's only 60 degrees or 57 degrees, but last night was cold.
Yeah.
But went back to the statistics, and I hadn't done the statistics in about 4 weeks. And just wanted to show that I'm not sure I'm going to do the testing statistics anymore because there's so many different kinds of testing going on, and Mass Health is reporting them in so many ways, including testing in our own field. About 118,000 people were tested last week. And that means a total, both duplicate and new people, are over 2 million people in our state that have had tests of one kind or another since tests started to happen somewhere, I don't know, maybe in May, late April, or even more, actually March. What am I talking about? They did have tests in March, even though it was slow as molasses. And we had 94 deaths in the past week. And this is off of Mass Health isn't showing daily, they're showing daily reports, but they're also doing a weekly Wednesday report now. So these numbers are from Thursdays from the command center after their week update. So I just want people to know that it's not Friday to Friday anymore that I'm sharing. So we've had a total of 9,051 deaths. And the average death age of continues to be very high, though the average illnesses, I saw one group of illnesses that didn't go to the hospital were much lower than that. I think it was in the 50s, the age range. So I think that's interesting. More younger people are getting sick than older people. Maybe older people are being more careful. And I compared these stats to the last time I did some comparisons. And you can see in August, the last time I did this, there was 133,000 in a week that were tested. New cases were about 2,000. So 2,380 is higher given that colleges are back. That makes sense. And deaths that week were 88. So even with the colleges back, and obviously these are higher numbers than even August, where August had started to go back up a little bit. It gives you a sense of where we're at as a state. So I'll probably drop testing from now on. I'll just be reporting new cases and deaths. So again, our sympathy to everybody who's experienced death or tragedy. And I know other people have gotten sick and not died, but had struggled to get their conditioning back. Many stories of people who have needed rehabilitation for months to get back to where they were. So in our field, we're getting snapshots every Wednesday as well. There's the facilities dashboard, and there's the dashboard for residential homes. And as you can see, there was, as of September 16th, 5 in state-operated homes. Now the census there is about 1,000 people, and there was about 12 active cases reported among 7,400 people in what's POS means purchase of service, so private providers, and most of those are nonprofits, but there's a fair number of for-profits in there, maybe 5%, something like that. And I leave you guys will get the link again to see it for yourself. So that means Wednesday, 9/23, there'll be the new report. And as you know, they're not being accumulated anymore. So just on the federal level, we're all concerned. We had our friend Nicole on last week. The stimulus, I actually went online to see if there was any yapping about a stimulus. Nope. As you know, there's the president. I think the Senate has decided to let the president lead with his ideas, and they have that extension of unemployment that he was putting $300 on the table and wanted the states to put $100 on the table. And Governor Baker questioned that, given they're looking for a stimulus 4. Technically 5. We had stimulus as 3.5 so far. So there's no talk of that. And then last week, Nicole intimated that it looked like a deal was being made for the federal government, that no one in their right mind would want to not have a deal on appropriations. So instead of negotiating with the Senate, the House was negotiating with Treasury Secretary Steve Mnuchin. Should be an I there. Sorry about that. I'll try to fix that before you see it. So most funding levels will stay the same as the current year. So no good news on a stimulus. So I'm excited to have Dan Burke with us today. And there's a picture I found of Dan that was better than the one I thought on his website. I was looking for some old ones, but I decided.
This one hides the bald spots now.
Isn't that good? Yeah. So he served as the CEO of ARC of South Norfolk and Lifeworks since October 2010. Wow, that's hard to believe. By the way, I just got a note from your predecessor, Dan, this week.
Oh, good.
Back a note. Yeah, I was shocked. He's miss him. He's a great guy, and we worked with both of them, Dan and I, Bill Abel. And Dan received his degree, I have to say this, in rehabilitative services from Syracuse University, which is known for its disability studies department. And the right about that is I've known Dan a long time, and I'd forgotten that he was a Syracuse graduate. They had taken classes with some of the big shots in the old days who were really, came from a certain perspective, excellent on human rights, excellent on whole range of things. And actually, that was where the facilitated communication started, Dan, right?
Correct.
So,
for some people very endorse it, and some very controversial for others. But
yeah, Bicklin, yeah. So that was a light for a while there. Dan serves on the boards, and of course Wolfensberg was there. I could go on with a bunch of names at Syracuse. So, but Dan serves on the boards of ADDP, and just recently he joined the board of the ARC of Massachusetts as a representative of the Council of Executives. So we're happy that he joined us and Gene Phelps. So they, are able to bring chapters input to the board that's predominantly, family members or from the business community and interested in our work. So anyway, that's his introduction. Today, what we want to do is, and I think later this week, Maura will have John on from Amigo, but we wanted to do a real update. What is it really like right now? What are people experiencing that are trying to help people with services and make the best effort they can in this COVID circumstance? And with Dan's organizations, they have residential services, employment services, family support services. So there's really a range. They have a self-advocacy group that meets regularly for years. I mean, back into the 80s, really from those days when the ARC used to have the Consumer Advisory Board that was going on as well. So he had employment support obviously going on because some were essential workers during the COVID crisis. Probably not a lot of people, but enough that people were out to support them. But the biggest thing, of course, at that time was residential services. And then in August, he opened his day services relatively early, he and his team. And they also more recently have increased what they've been doing in family support and social recreational services. So there's a lot going on. He'll share how it's going and also share about the agency's safety protocol. So Dan, you want to first, if you were to say where you're at now and your team's at right now, September 21st, and is it what?
September 21st. So we actually opened our day programs on Monday, July the 20th. Very slowly. We were among the first 3 or 4 in the state to open, and we opened our community-based day services programs in our 2 locations in Norwood and West Roxbury. And we opened our day habilitation programs here in Westwood and also in West Roxbury. And very slowly, as many people have been experiencing it otherwise. For example, our day hab opened between the 2 locations, I think, with 9 or 10 people. And our employment programs opened with 10 or 15 each in the first week or 2. We did, you referenced employment services. Some of the heroes in this whole crisis is that we had 25 people, Leo, who never stopped working. And we kept supporting them in jobs. They might have been at Stop and Shops or CVS's or restaurants doing takeout or doing cleaning in places. But we had about 25 people that worked through the entire pandemic, never took any.
How did they do, Dan? How did it go?
They did very well. Now, a single positive of all of them. Now, like everything else, the people that worked individual employment were expected to follow the protocols, and our job coaches coached them on the protocols at their company. So these people were all able to wear masks. They're all able to follow the protocols. They were either transporting independently or with their families, or the residential team would drive them. But we had job coaching being provided. We actually had a very unique situation at one of our enclaves, which is now reopened with people attending. But we actually had a group of staff who got together and staffed one of our enclaves while the folks were not able to attend, to keep our relationship going with that company, because they were a medical supplies company and they needed to stay in business and they needed our work done. So that was really,
wow.
That was really inspiring. So we opened in July and very slowly, and we did our assessments with families before. We called people, we identified who was interested in returning. We educated people around our safety protocols, and I'll talk about them in a minute because they're pretty extensive. We did a number of things that I'll talk about after to really make our sites work well. But mostly what we did is we didn't put any hard pressure on anybody, but who was interested in coming back, what was involved in them coming back, talking them through what would take place. Generally, in our employment and CBDS programs, we were strongly encouraging masks and really working on teaching masks. And I think early from the beginning, we had about 80 or 85% of the people wearing masks. Wow. And others we were educating. In our day habs, much lower percentage of the people we served wearing masks. But one of the choices we made as a team was not to require it. We were going to educate, we were going to teach, but we were not going to require it because we just thought that was going to be a lot, that was, our staff felt that was our role. All of our staff, of course, wear masks and follow protocols strongly. And people felt comfortable with that. And that's kind of worked, that's worked its way up. So we probably have been increasing every 5, 6, 8 people per site per day to the point now that we're at, we have some pretty good numbers. As we sit here today on Monday, the 21st of September, we're doing pretty well. In our employment programs, we have an average of 125 people attending weekly, with roughly about 75 of those people attending on an average daily basis between the two sites. Our day hab has an average daily of about 45 between two sites out of 128. So our attendance numbers are roughly around 30 to 35% of our full capacity, which sounds incredibly low if you're running programs, and it is, but it's very high as it compares to where COVID is. And then the 25 people we support individual jobs. We also have 4 enclaves that have returned, which is really exciting. So we have people coming in and going directly to enclave employment, and one of them includes a college. So we're excited about that.
Dan, 1 second. So just for people who aren't aware of that term, enclave really is about people situated at a business, and like you just mentioned, the college, and they're there, and they might have a staff. They usually have a staff person with them.
They have a staff, so it's a group that can run anywhere from 4 to 7 people. They might work together. They might be spread out within the company. We have a job coach there every day. We transport them every day, and most of the sites that are all back now are all minimum wage, or more. Those are all returning well. So we're moving along pretty well.
So you mentioned the average 35, as an example, or 35% capacity. What part of that is the space issue, and what part of that is just, you're
right now it's all about participation. Our space capacity would be 50%. So we still have room to grow in each location. Our Boston location is probably the one pushing it the most. I think that's one of the interesting sidelights to this, is that we are certainly seeing now that we have opened up more people coming back in Boston than we have in the suburbs in terms of percentage. And I think that's directly related to the fact that in Boston, we had less people participating in remote programming. We're offering a full platform of remote programming. I want to say that we have that we make as available to everybody as possible, strongly encouraging it. We're still increasing our remote platform, but in Boston, the access to remote programming is less. So when we opened up, people were coming back.
So just to help people like a little bit about that, we had a meeting, and we asked about the remote, and you brought up the digital divide, urban versus suburban, and the concern that people were really disconnected because of the lack of internet or the lack of equipment in urban. Is that true, Dan?
Absolutely. I think that as all members of the ARC, that's something that we all have to pay close attention to over the next few months. I know my colleagues and I share that, is that urban-suburban divide, or more importantly, the economic divide about access to remote services and the ability to get remote help because people don't have consistent internet contact. They don't have the equipment. They don't have the ability or the support to sign in. English as a second language in many homes. While we have staff that speak several languages, that divide concerns us as we go forward. And it's something we all need, as we all know that I think we all believe that remote services are here to stay, and their telehealth and remote services are great support. We need to do everything we can to make sure that that does not increase that divide.
And you told me something that was pretty interesting. You told me a few weeks ago that you had a team going out to the city, right?
Absolutely.
So
Actually, Leo, I'm gonna dovetail, because I think my friend Sarah Charbonneau, who's our vice president of day service, because Sarah was the leader of this. Sarah, can you talk about the visiting people's homes to get them involved?
Yeah, sure thing.
Hi, Sarah. Good to see you.
Hi. So yeah, we ran into some challenges with some folks, as you were saying. They just don't have the access. And so, we really were worried about losing engagement as time went by. And, I make this example that, like, similar to the gym, the longer you not at the gym, the less you really want to go back. So I wanted to make sure that we didn't lose these folks. And so we came up with a team of 2 staff, and we make some individualized packets for them so that it would go along with the Zoom programming if we can get them to get a little more excited about that. And so we'll go out and we do a route twice a week, just to have a face-to-face conversation, let these people know that we're thinking of them and we would love to see them back, and then give them something, to show them that we were tailoring some curriculum towards them, and we really would like to have them join Zoom. So at the very least, we are seeing them a few times a week in person, even though that it is for a briefer version, and still trying to encourage them. But at the same time, we really think that it definitely has helped raise spirits by going out. So.
And the idea that maybe some of them, you might figure out a way they can use their hotspot on the phone or something they don't have.
Absolutely. So that's what we were trying to do with that face-to-face connection, is we've literally drawn up instructions for, an iPhone, an Android, a this, a that, so we can see what is it that you're using, what is it that you have access to. And literally the case managers are just on the spot trying to do some, step-by-step instructions to help them a little bit more.
Excellent.
And so, Leo, I would say, before, because people will probably ask that, I don't want to skip by, because it's so important. Safety protocols upon returning, it's really important. You asked me before, were we limited by people coming back? I think the other piece is fear and concern. People are very fearful and people are concerned. And it's not just people who live with families. There are other agencies that have residentials that are not having people return. So, we have a pretty extensive safety protocol, so people understand. It starts at home before you even get on your van. We have a virtual system where people call in and answer a series of 7 or 8 questions on the people coming in. It takes about 20 seconds to do it. It's the questions we're all used to in life. Symptoms, have you been anywhere? Do you have a temperature? Any of that stuff. So residences do that, families do that before they ever get on the van. Our vans are all safely divided. Nobody is inside 6 feet, so we don't have any more than 5 people on a van. Some vans smaller, the smaller vans have less people. So we are following safety protocols. We have divides between the driver and folks, and everybody on the van is being strongly encouraged or really pushed to wear masks. When they arrive at the program, at all of our locations, we're taking temperatures. We're doing a screening when they come in. We're reviewing it, and all of our locations have a quarantine room. So from the time they come off the van to the time they leave, we have a place to quarantine people, and we're constantly monitoring that. We've done a number of things. We are socially distancing in all of our spaces in our day programs. So we've got people spread out. We are not doing some of the shared activities like cooking classes and those things, because we're not sharing food or any of those activities that used to happen. So we have to limit that. We've greatly increased our cleaning. So we brought in professional cleaning and supports so that we're right there when there are issues or changes. We're cleaning. We have the electrostatic sprayers that we're using in the building at the end of a week. We're spraying our vans. So we're taking a lot of protocols. And I guess that for people who are on the call who are concerned or wondering, all I can say is, and I don't want to jinx us, we're on 9 weeks. We're on 9 weeks with no positives. That's the least thing I can say before Sarah yells at me for not jinxing. So we're very lucky. So I think we are working with families and everybody and really encouraging people to be safe. If they wake up and they don't feel exactly right, stay home. We work with everybody to assess them, and that part has worked out well. And we do the same protocols for our staff. People ask often, well, you watch our folks come in and go, our staff have to call in before they come in. They have a virtual sign and they have to come in. They come in every day. We all take our temperatures. The first thing I do when I walk in this office is to take our temperature and to answer the question. So we're all doing it every day.
So you said your staff call in, and before they even show up, you're having them call in, or?
Sarah, you want to describe her briefly? Sarah designed this with our tech team. So
Yes.
Well, a doctor's visit, huh? Go ahead.
Yeah, it's essentially the same link that I have for the individuals, but it applies to staff. So I did separate them out, but I do ask that they have it completed an hour prior to them coming in, just in case I do need to, find a different staff member.
Right.
And then the fun part about that, at least I thought it was kind of a nifty version, was that depending upon if people hit yes to certain questions, it will automatically alert myself and the nurse. And that way we have a team to jump on it immediately and then address any symptoms or what potential recourse might be, so that we know before anybody even steps in the building.
So if somebody suddenly said they weren't coming in that day, you'd immediately think about who they were with the day before.
And we've had multiple times where people have hit yes. Sarah and the nurse talk it through. That's certain, stay home. And then we back through to see if they've had anything. And it ends up not needing to be tested. Or maybe they did go get tested and they're okay. We now have the ability to test people ourselves. As people may be aware, our residences are in the middle of getting tested, and we've just about completed it. And the next level of supports for our day programs and for our office staff and everybody is that we now own 300 to 400 testing kits, and our nurses are all trained. We have about half a dozen nurses trained, and we'll be able to test our own people and get results in less than 36 hours.
Wow. Excellent. I want to switch. Maybe we'll do questions and answers at the end, because some may have more questions about the day. I do have one more question about day. Then I want to switch and talk about the family sport and social recreational a little bit, because that's different. I don't know how many people are doing that, honestly. So just on the day, you said people aren't wearing masks, and
some are and some aren't. Not just okay. So maybe 20%.
What percentage?
Probably 20 to 25% are wearing masks.
Okay, and then
I would say this is more of a guess from my walking around the day hab, about 20% are wearing them, but not well.
Right, gotcha.
They're trying, and it's a teaching part.
Right, and so your staff bought into, it's like a team decision, right? Partly, and partly your goal as an organization to have as many people be able to come back and benefit, because obviously people with rehabilitation might not have the same positive experience with remote, right? That others may have.
Well, right? That's part of it. Remote for the day hab is hard because it's a 2-person participation plus our staff. It's the individual plus a staff member or family member at home assisting them in almost all circumstances. Our day hab is a pretty medically intensive day hab. So we have a lot of people in wheelchairs, a lot of people needing medical supports. And so we, as a team, realized that requiring masks would have limited our attendance to next to nothing in terms of the people we support. Some can't wear masks because of breathing issues, some other issues. So, we were very fortunate. We have a really dedicated team of staff who were unanimous about, we'll all do everything. You do the research. And the research is you protect yourself by wearing a mask. You protect yourself by appropriately wearing gloves when you're supposed to, and being really well aware of good glove management, which does not mean wearing gloves every moment of the day, but it means wearing gloves at the appropriate time and disposing of them properly, and washing our hands, and creating an environment that is socially distanced. we felt that we could serve them. And so far it's worked out well. You know, families come in for tours, they take a look, they see what they feel comfortable with, but so far it's worked out pretty well.
Excellent. All right. Thank you. And one of the things I guess I should add to this is you didn't have electrostatic machines before, nor did your fellow organizations, right? You
No.
didn't have staff time built in for the cleaning, that type of cleaning,
Correct.
right? You
Correct.
didn't have the links that Sarah talked about. Sarah, you had to take the time to develop those, and yes, it's a one-time thing, maybe develop it and every once in a while revise it, but you still have to worry about it every day, that it's happening, that the people are filling it out. So there is a certain level of monitoring every day that wasn't there before, right?
Oh,
Right.
definitely, yes.
Yeah, so these are all things you and other agencies have taken on as costs.
Sure.
Yeah.
We started in the middle of June when we realized it was going to happen. Sarah chaired our reopening committee. They met multiple times a week, sometimes multiple times a day. And, you know, what do we need to do? This sounds like a good idea. Let's do it and figure it out. And it's kind of the way everybody's been doing. So on the other programs, Leo, we have opened everything a little bit at a time. So our family support program, our programs have been open throughout the whole thing. I will say that, you know, if you go on our website, I do some video updates. Programs have been open. Family support staff have been here and been available remote to their folks every day. AFC, our Autism Support Center, have been available to people every single day.
And AFC's adult family or foster care, for those of you that might not know it. Go ahead.
Yep. All done through telehealth. But now we are starting in over the last 2 months of in-home visits for some folks in family support, in-home visits for our Autism Support Center. We're also doing some community support programs. What we call CSGs, community support groups, are going to start over the next month, which are small groups of people doing social outings. We have had some social experiences here at our offices here in Westwood outside or using large space. Our self-advocacy group has started meeting. They've had a couple of meetings, which has been great. Our social recreation program ran their bocce program and the softball program, and now is doing cornhole in the fall, all socially distanced, but ran them since the middle of July, which has been great. You know, less participation. You know, for example, bocce normally has 40 people over 2 hours. It turned into 30 people over 3 hours,
Wow.
10 people every hour. You couldn't hang and stay the whole time. But the Italian American Club in Walpole, and we had a really positive experience with them. And we just had 10 people an hour. So we didn't have large groups, and it worked out. Everybody distanced and wore masks. We follow the same protocols for everything. Every event we run, every participation we run starts with the taking your temperature, the questions, wearing masks, socially distance. Those are our rules for our events. How can we build that into all of the things we do?
So that's pretty exciting to have 30 out of 40, like the bocce example.
Yeah, people came. People were looking to do things. Now, of course, these are all things that are outside. And that's, you know, as we get to the winter, obviously concerns us, but we're, you know, in our day, but I want to say our family support people are going into people's homes. They're dealing with the emergency situations that we deal with all the time. They're supporting families. We have a specialty counseling clinic here called Harbor Counseling that provides behavioral and mental health supports for people with intellectual and developmental disabilities. Those staff have been doing telehealth services, and now we've started to open up for individual one-on-one therapy. Our psychiatrist has been working telehealth since the day this crisis hit, so we have not missed 1 week of appointments for those kind of supports for people, doing mostly all telehealth. People can request to come in, but they're actually liking that via telehealth, which is fine, which is great. So we're just trying to do it. My rule as the CEO is we will talk about every service opening as long as we check the boxes on the things I said before, the safety protocols. As long as we're doing the best, and it's all by choice, and people participate if they want to.
And the safety protocol, you know, that you've talked about, do you do the same in social and rec and all of that?
We do. We do. Yep, we do.
And the outdoor helps to the extent you're doing it outdoors, right?
Absolutely. Outdoors is big. Right now, it's pretty much all outdoors. Our self-advocacy group meets we have one big, large room here, the community room, the Jane Smith community room, and we've been able to have a couple of self-advocacy meetings inside when they wanted to. They've also, some of the groups have had, our autism support has groups that meet in 3 or 4, and they've done some cookouts outside and that stuff. So they've done hiking. That's been a popular thing for the last 6 weeks, is a hiking group, which is great outside. So for within our autism support center. So those are all things that we're continuing to move forward.
So one thing I want people to know, I'm going to open it up for some chat questions and verbal questions. But before I do that, I realize, again, I take for granted everybody knows all the terms we use. So when we said CBDS, that's community-based day supports, both that and employment are funded through the Department of Developmental Services. There's some more flexibility in those. The regulations are a little different, and they're very inclusion-oriented, whereas day habilitation, which is a mass health funded service, has, as you noted, in your case too, you serve people with complex medical conditions, so there's nurses involved, therapists, has more regulatory things, less inclusion, less integration, and but anyway, so there's the challenge in terms of.
And I'll say, Leo, I'll just say before as we open it up, that people have said, well, the reason I mentioned the mass thing, people say, well, you'd probably open for the most capable, most independent people. We currently, out of 35 people in our day have 5 people who are getting one-to-one supports. So
wow.
we're serving people of all ranges. We're not putting any limits on that stuff.
That's great. That's great. And I'm hoping we're going to advertise this recording, because I really want people to hear about not only what you're doing, but to realize from what you're doing, probably others are doing some of the similar things, and not be fearful, right? You talk to your colleagues all the time.
And every agency is doing what they can, in part based on their physical space. We are really fortunate to have a physical space capability that allows us to be a little more aggressive. We have big open spaces in all 3 of our day program sites, with multiple entrances in all of our day program sites. And we do a lot of our own transportation. So we have some advantages that we're just taking advantage. We're able to help us out.
Great. So I want to open it up a little bit. I don't know if people, there's some stuff. If Kerry, you want to help me, or I see Mike Malone. Mike's got a question. Oh no, already was answered.
No questions from Mike Malone.
It was a question about money, and saying Dan is he's assuming you're operating with about 65% or more less revenue, and is this resulting in layoffs?
So to that question, we started with a number of people that were on furlough. Because we do residential, like a number of agencies, we moved dozens of staff into our residences when this all hit in March. We kept a skeleton crew in our employment and life enhancement CBDS program, and skeleton crew in our day hab. And as services have started to reopen, we have eased people back, leaving others in our residences. We still have a few people working in residences, but we're easing people back. We had a number of people who chose not to come back. We had some vacancies. So I would say unfortunately, due to the hiring crisis, one of the reasons we haven't had more layoffs is, especially in our day hab, we had a number of vacancies we just haven't had to we didn't have to deal with those situations.
But so you figured out financially somehow to do it for the time being, because again, it's been tough, especially day only providers. It's been really tough. There's a question from Kathy, who I've talked to in the past, to everyone, but like, this is a good example of the fear that, you have families with the same concerns. Her son's program had a death on September 14th. He's still at home with her. He's also typically would be in a residence as well. And so he's at home, and also not, I don't think, going for the day. She's looking for new placements. He's concerned that the agency was hit very hard where he had been. So she's looking at new placements, but individuals seem sick on and off. Now, at the beginning, I said there are 12 out of 7,400 people right now who have the virus and 5 out of 1,000, which is very low, but I can understand why people would be nervous, right, Dan? Because
Yep.
it's still out there.
Oh, absolutely. That's why we try to be really safe, and Sarah and them, but we try to be very safe how we reference it. Everybody is trying their best and doing everything they can. We try to keep people working with the same people every day. I think there's a lot of agencies that are doing everything they can within their staffing ability to try to limit cross-contamination in both day and residences and those kind of things. But it's hard, as I think Mike referenced, is especially people that are day only. We've got a sorry.
All right.
All right. Hit mute. We've got a situation. It's actually a person we serve. I've served for a long time. Calling me. Without the retainer payments, we wouldn't have been able to do this. Without the funding that DDS funded the day programs in May and June and July, and we're all really concerned this going forward, because if we're doing this at 30-40% capacity and the retainer payments reduce and we don't have it in December and January, it's going to be a whole different story to what Mike was saying. Without additional supports, if we're limited in capacity of 50%, and we're also limited by transportation, and we're limited by people's fears, and then we aren't given support to be able to keep our programs open, people aren't going to be able to continue to do it with leases and staffing and everything else. That's not going to be able to happen.
Well, you were fortunate in a couple, well, I don't know if it was fortunate. I think you were just proactive in that you actually handled transportation for people you historically didn't transport early on, right?
And I had a whole group of drivers that were laid off. To Mike's point, my drivers and relief staff and support staff were laid off, and we were able to bring them back because they wanted to come back. I was very pleased that a number of them worked 20 hours a week and they wanted to come back. So, but we control our own transportation.
So one of our good colleagues, Judy, who we know, she's up a little north there, and she's saying how, her agency and most of their folks are in the #1 spot for COVID right now, Lynn and surroundings. And so their family support center at Bridgewell is not open, and they're working remotely with families and continue to do so as they have since March. And they've got a good program up there. And again, it's a really hard call.
And I will say that we are monitoring that all the time, much like Judy's folks are, because we're located in Westwood right now. Dedham, Plainville, Rentham are a little bit hotspot, so we're watching that. We serve people from throughout the city, so we're watching that. We watch it all the time, and everybody is doing everything they can. For example, like Judy at Bridgewell, they're doing a wonderful job of doing everything they can to support people remotely, as we continue to do, because we got to do everything we can not to increase people's risk. It's great when we can go into people's homes. It's great when we can provide a place for people to go. But like for our example here, we have protocols, I'm sure Judy's done, when people need to be picked up by families, we have it in our lobbies and they come in and they get it. They don't come in our buildings. And we've dropped off PPE and food and other things on families' doorsteps and that type of stuff. It's done differently to help support families.
Yeah. And Judy added that their day program's open at 25%. They're nervous to jinx it. Judy,
I won't tell Chris you put that down. Oh, I promise.
He doesn't mind probably. And then when it gets colder, the whole idea of picking outdoors versus in a lobby is going to get tricky. We'll see what happens. I saw the YMCA in my neighborhood at a summer camp this year. They seem to be handling it pretty well, and they had the drop-offs, of course, outside. And most of the camp was outside, except for rainy days. I'm not even sure what the heck they did on rainy days, but since the whole place was open to some degree. Anybody else want to ask a question of Dan or Sarah while they're here with us? And then I might do a review of where we're at service-wise before. Yeah, go ahead.
I just want to say that Zoom is great if you have to use it. Working remotely is great if you have to use it, but all the people that I know definitely feel a disconnect.
Yeah.
It's not the same as person to person. And can't wait to get back to their programs and
How much
And people
contact are
say,
you
"Hello,
having, Ann?
Leo."
You're pretty independent. Hi, Jared. Ann, how much contact are you having?
I'm there for meetings when I have to be for Zoom meetings. I miss being with the people and having the face-to-face interaction.
Yeah, yeah.
On Zoom meetings, people don't speak up. You can't really have a good conversation and interaction, read people's facial expressions.
Yeah,
and
even
stuff like
if you
that.
could, it's not the same thing, right, Ann? It's really not. I
It's
mean,
not the
yeah.
same.
And I've been having a hell of, number of meetings. I can't even imagine as number of you on the call have been having.
It's
Yeah,
harder to really tell what people are saying and hear them as clearly
Right.
and help them out.
Yeah.
It's just not the same.
Hey, Sue jumped in, Sue, who we know. And he said, my son Patrick was in the first group to return, and the administrative staff done a tremendous job. I can't thank them enough. And I can't tell you this, Dan, I don't want your head to blow up, but she thanks you for your leadership. So that's awesome.
So, Leo, I would say, I think Ann's point is something that we're all talking about. What's the future going to be? And I think I referenced this at the beginning. I think we all acknowledge that remote services and a remote library of supports is going to be part of the future. It's not going to replace day programs. It's not going to replace individualized supports when people are coming to people's houses and those things, because that connection, that interpersonal connection is the essence of human services and needs to continue. But I think it can provide additional supports. And I think the telehealth piece, I'm excited about, because my residential staff tell me this, and my behavioral health clinic tells me we're actually able to get to things quicker. We're able to access people to specialists and that stuff in a quicker way, especially things from Boston, using telehealth. So I think there is some opportunities there to increase the supports for people we serve.
Great, great.
But with telehealth, we still have to remember to give individuals independence.
Yep. Agree completely.
Yeah, make sure they're involved in the discussion, and of course.
Oh,
yeah.
absolutely. We don't replace them at all.
Yeah.
Exactly.
I think that, the fact that Sarah described, you had people going to homes, even for those short visits, which financially, that's all you can do. It's tough enough, just for people to appreciate that the whole models and day programs, they're based on ratios and staffing models of one staff to a certain number of people. And yeah, you may have one-on-ones for some of those people, but, and those people could have a one-on-one, but if you can imagine, there's a reason they have a one-on-one in a day program, so it's not, it's really hard to, anyway.
I'm sure, just like Judy at Bridgewell and Mike and his team and Jewel and their team at HMEA and other providers on the call, we've worked with DDS in areas that we work with, such as Greater Boston and Newton, South Norfolk, to get tablets and laptops to people's homes. It's been great through family support. We've provided dozens of those through DDS. The issue, as you and I talked about, Leo, a couple weeks ago, is now how do we get hotspots? How do we get internet?
Right.
How does that happen? How do we teach families that if they have phone, the phone can be the hotspot? That's the backup piece.
And as Ann was speaking, we know there are people who are losing out. They don't even have the Zoom connection,
right,
as we've talked about over the past week. So I'm going to have to call it a meeting. Judy, thank you for mentioning the Club Rosewood opening first week of November. I think we're all nervous. We'd love to get through November, maybe early December, and see that this isn't like the flu, that if we sort of behave ourselves and do what we're all talking about, that we can beat it. We don't have to see a surge. That's what I'm hoping for, and I'm sure all of you are hoping for. I want to just say, thank you for being on today, Tuesday and Thursday, Tuesday at 11, Thursday at 11. And as I mentioned earlier, John, we'll be on from Amigo, and here are the times and dates of the next lives. And next week, I'm pretty sure I have a special thing, as I did with Dan, with Bruce Bird from VinFin, who's going to talk about a new federal grant through Mass General Hospital that includes a number of providers around best practices for COVID. So that's going to be something as well. There's a lot going on. We'll keep you up to date. and have a great week, and see you guys on the other side. Take care.
Thanks for having me, Leo. Appreciate it.
We appreciate it, and I appreciate Sarah joining us as well, and everybody else. Take care. Bye-bye now.